the female category, consultations with a wide range of experts in relevant fields, and lessons learned and feedback from the Olympic movement constituents. So what I'd like to do is take you through a little bit of that journey from the perspective of the creation of the working group in particular. As we had the working group, we also ensured that there were consultations and exchanges with the experts from the IOC administration. And the review process was underpinned by this extensive and structured consultation and exchanges with experts that conducted between January 2025 and February 2026. The consultations were designed to ensure that this policy development was informed by scientific, medical, legal, ethical, human rights, and athlete perspectives, as well as operational realities across the Olympic movement. And so these included, in particular, athletes. We consulted with athletes 3 different ways: through a survey that was sent to as part of the Fit for the Future consultation, and included over 1,100 responses from athletes themselves on the considerations related to the topic. We also had one-on-one individual consultations with impacted athletes from all over the world. And we also had exchanges with the Athletes Commission, or the IOC. We looked at reviewing developments in science. We looked at the review of the International Federation, IF, the Chief Medical Officer concerns and developments in their policies. We reviewed the developments in law and also development in Olympic movement constituent perspectives. We had extensive input from IFs, including through surveys. The chief medical officers, we met one-on-one with all of them through the Olympic movement, as well as had surveys with them, and along with the workshop as well, to understand what their opportunities and challenges that they identified on this particular topic. And essentially, in June 2025, as you may recall, the President issued the mandate to create a working group to review, to protect the female category. And it was as a result of this is that a working group composed of experts from all around the world, all 5 continents, that was formed. The working group was composed of experts from a wide range of fields, including women's health, from endocrinology, from law, sports science, and so on. And it came together 4 times over the last 7 months. And there were many written exchanges as well. The key outcomes for that group was to achieve consensus on definitions related to the female category, and also on a range of scientific statements that would underpin the policy itself. We wanted also to ensure that IF, so International Federation Chief Medical Officers, were included. That would ensure scientific depth and also practical implementation insight. And these IF Chief Medical Officers were from a range of sports, including contact, non-contact sports, individual and team sports, and winter and summer sports as well. Their mandate included reaching consensus on these definitions and then to assist with guidance on implementation when the policy would be rolled out. I'm very happy to say that the group was fantastic to be able to work with, collaborative, and oftentimes we're able to reach consensus on a number of difficult topics. When we looked at the definitions and scientific statements, all of them reached almost a 100% agreement. We set the bar at 70% agreement, which is consistent with scientific evidence and literature, and ensured that we had those definitions that those in the working group were very happy with them and could stand behind them. So this included those definitions and scientific statements. They also provided input on other aspects of the policy, but most importantly are a group that we can continue to work with on the next steps regarding implementation. In terms of definitions that you would see in the policy, now that it's with you, we wanted to ensure that the working group reached consensus on the definitions so that everyone was speaking from a common language when dealing with this particular category and topic. We understand that in the media sometimes many of the terms can be confused or difficult to understand, and that it would be important for us in order to understand the working group's work that there was a set of terms that everyone could get behind. So essentially, I won't take you through all of them, but the essential ones for the group's work was to agree upon even the term sex and gender. So with respect to sex, that the working group defined sex as either of the two categories, male or female, into which humans are divided according to their reproductive biology. A biological female then would be an individual who, regardless of legal sex or gender identity, experienced female sex development, usually based on XX chromosomes, ovaries, and estrogenic hormones. A biological male would be an individual, regardless of their legal sex or gender identity, who experienced male sex development based on XY chromosomes, testes, and androgenic hormones. We often hear in this topic of differences or disorders of sex development. These were defined by the working group as rare genetic conditions that result in atypical sex development. And an XY DSD would be a DSD that affects a biological male with the SRY gene. With rare exceptions, athletes with XY DSD have testes, testicles, and testosterone in the male range, and the vast majority are androgen sensitive. We also looked at any exceptions to the rule in terms of the male sex development pathway if an individual had an XY DSD. The working group defined one of these, complete androgen insensitivity syndrome, as an XY DSD, so a DSD with, from an individual with XY chromosomes, which would be characterized by the body's inability to respond to androgens, including testosterone. So as a result, although the individual has XY chromosomes, testes, testicles, and testosterone levels in the male range, they do not experience androgen-dependent male sex development. And finally, we went to define gender identity, and the working group reached consensus on this defined term as well, along with transgender. They defined gender identity as a person's sense of themselves as a woman or man, or neither, non-binary. While biological sex does not and cannot change, a person's gender identity can change over the course of a lifetime. A transgender individual is one whose gender identity is different from their biological sex. For example, they may have typical male sex development but female gender identity, or typical female sex development but male gender identity. Some transgender people take gender-affirming hormones and treatment and or undergo gender-affirming surgeries, and others do not. The SRY gene that I alluded to before is a segment of DNA which is almost always on the Y chromosome that signals the presence of testes and testicles, initiating male sex development by the production of testosterone. SRY stands for sex-determining region Y. So when we looked, we asked the working group to review the state of the science, including the development since 2021, and they reached consensus that male sex confers performance advantage in all sports and events that rely on strength, power, and/or endurance, and that to protect fairness in such sports and events, as well as safety, particularly in contact sports, so combat, collision, and projectile sports, that it would be necessary and adequate to base eligibility for competition on biological sex, and that the most accurate and least intrusive way currently available to screen for biological sex is by screening for the SRY gene. Furthermore, they let us know that sex and gender, they defined, as was defined before, they informed us that sex and gender is distinct from gender identity, sex and gender are distinct from one another, and that testosterone levels in healthy adult males are 15 to 20 times more higher in circulating testosterone than healthy adult females. So testosterone levels do not overlap between the groups. And the gap in testosterone levels exists in both general and elite athlete populations, so that males experience 3 significant testosterone peaks in utero, in mini-puberty of infancy, and beginning in adolescent puberty throughout adulthood. And so consistent with those higher circulating testosterone levels, males have larger and stronger skeletal muscle and bone, larger and stronger hearts, larger lung size, more red blood cells, and lower body fat than females trained to an equivalent level. Together, these attributes afford males individual sex-based performance advantages in sports and events that rely on strength, power, and endurance. Furthermore, female athletes can experience performance disadvantages relative to male, associated with female anatomy and physiology, And these disadvantages may include menstrual cycle, gestation, or anatomical differences, such as periodic ligament laxity or looseness, wider hips, or more breast tissue. And finally, that XY transgender athletes and athletes with certain XY differences and disorders in sex development have anatomical and physiological advantages in line with being male, even as their legal sex, in the manner in which they were raised and/or their gender identity may vary. So XY transgender athletes and athletes with XY DSD typically have testes, testicles, and testosterone levels in the male range. The clear majority are androgen sensitive, meaning that their bodies are receptive to and make use of that testosterone during growth and development and throughout their athletic career. These transgender athletes and androgen-sensitive XY-DSD athletes retain that male performance advantage due to training effects and fixed traits, and that there's no current evidence that testosterone suppression or gender-affirming hormone treatment eliminates this advantage. XY-DSD with complete androgen insensitivity syndrome and other rare XY-DSDs do not benefit from the anabolic or performance-enhancing effects of testosterone, and on that basis should be included in the female category. When the working group looked at the magnitude of advantage, they concluded that at the elite level, the magnitude is different depending on the sport or event, but 10 to 12% advantage in most running or swimming events, 20% male performance advantage in most throwing and jumping events, and male performance advantage can be greater than 100% in events that involve explosive power, so collision, lifting, and punching sports. This varies across sports, but in particular in contact sports, the strength and power differential between males and females may increase safety risks to female athletes. With respect to SRY gene screening, the working group concluded that screening for the SRY gene via saliva, cheek swab, or blood sample is minimally intrusive, that the presence of this gene is fixed and thus provides better evidence of biological sex than measuring testosterone levels, which are variable and can be changed, and that all biological female athletes screened will be negative and eligible, and virtually all athletes who screen positive will have testes or testicles that naturally produce testosterone at adult male levels. Because a positive SRY gene screen does not establish a specific DSD diagnosis, that further evaluation should be made available to the athlete to determine whether they have complete androgen insensitivity syndrome or another rare XY DSD that precludes testosterone's anabolic or performance-enhancing effects. Now, you have the rest of the policy in front of you, but may I just emphasize as well that one thing that was very important to us, and really from the outset of creating this working group, was to ensure that we needed a scientific but also an empathetic approach. We wanted to ensure that this policy was athlete-centered in its creation, but also in its implementation. And one aspect that in terms of our guiding principles to the international federations and sport governing bodies, we want these organizations to ensure that athletes' human dignity, physical and psychological well-being, health and safety, and right to privacy and confidentiality are respected. They should educate athletes, coaches, managers, and other members of the athlete's entourage, and ensure full transparency of the process from beginning to end. They should establish internal mechanisms that offer athletes and other impacted stakeholders accessible, legitimate, safe, and predictable avenues to obtain information on the process, and encourage screening for biological sex early in their athletic career. Certainly to carefully consider the special situation of minors and ensure that appropriate safeguards and protections are in place, and wherever possible, combining SRY gene screening with regular health evaluations. And for many, in fact, all of the athlete-centered considerations, these come broadly from themes that were taken from consultations with the athletes. The athlete's voice was respected and integrated within the policy, and makes it much stronger. We wanted to also reassure athletes that all athletes have a place in sport according to their age, their sex, and their skill, that biological sex-based eligibility criteria, including SRY gene screening, are not a judgment on and do not question the athlete's sex, legal sex, or gender identity. SRY gene screening is highly accurate, non-invasive screen for biological sex. So unless there's reason to believe that the results are in error, this screening will be required only once in the athlete's lifetime. We want to ensure that physical examinations are not required for initial sport eligibility determinations, and that access to mental health and safeguarding resources for athletes undergoing SRY gene screening, particularly those with a positive result, be made available. Finally, in going forward for implementation, the IOC will organize a series of workshops, seminars, and/or webinars with IFs and NOCs, which will include athlete representation to provide guidance and facilitate the exchange of information and athlete-centered best practices related to the implementation of this policy. These workshops will provide a platform to share experiences, discuss practical challenges, and promote consistent, safe, and effective application of the policy across the Olympic movement. We understand the right to privacy and confidentiality and want to maintain that that's an integral part of implementation going forward. For the athletes, this is essential. That organizations, so international federations and sport governing bodies, would comply with all of the applicable data protection and privacy laws, and ensure that they comply with all applicable laws and regulations, including governing genetic screening for sex. In a nutshell, as you do have the policy in front of you, we would just emphasize that eligibility for any female category is limited to biological females. If they're SRY negative, they have permanent eligibility for the female category. If SRY positive, they would be ineligible, but there would be an exception for those athletes with complete androgen insensitivity syndrome or other rare XY DSDs. And at this point, I will stop there. Thank you, Mark.
Jane, thank you very much indeed for that. And I think you'll forgive us for giving you a detailed presentation on obviously what is a very important and complex piece of policy. So let's now, without further ado, let's go to some of your questions. As I say, we have more than 100 journalists online, so please do keep your questions to this topic because I think we're going to have a lot of questions. So let's start with Wakako Yuki from Yomiuri Shimbun in Tokyo, I guess. So over to you, Wakako.
Thank you indeed, Mark. Hope you can hear me.
Yeah, Wakako, we can vaguely hear you. We need the volume up a little bit more if we can.
What about what about this? That be okay?
Yeah, we can see you now. Can you just try again?
Yeah. How this? Can you hear me?
Yeah, that's perfect.
Okay. Wonderful. All right. Thank you so much for the opportunity. And two quick questions for the President, if I may. One is, you are obviously, you are, of course, advocating the necessity of these kind of guidelines even before your candidacy of the presidency. And as a female Olympian, why did you strongly believe that this step is necessary? Have you faced voices of doubt for the fairness of competitions? What is your personal view or experience on this? And if I may, to the second part, at the very bottom of this policy, the IOC said this policy would not be applicable to grassroots level. Thank you for that, but it may not be so easy. Obviously, grassroots level and education level may consist a lot of competitions, which would lead up to somewhat elite level. And what is your advice or view message to, for instance, National Olympic Committees, sports federations who are in charge of promotion of sports, which inevitably face a question, how much to keep to this IOC policy while protecting basic human rights, which is to be able to enjoy sport regardless of who you are. Thank you.
Hi, Wakako, and thank you for your two questions. As you said, yes, I was advocating for the protection of the female category in sport, especially also during the campaign and before that as well. And the two reasons for me, one, it was safety on the field of play, and fairness. And that really, I think, one of the things that we like to see, especially in sport, is fair and equal treatment of everyone on that field of play. So for me, those were really the two personal reasons that I felt very strongly around this. And knowing the sensitivities around this topic as well, it was that wasn't just enough, right? We needed to ensure that we were being led by medical and science in this specific area. And it wasn't just something, it wasn't just a feeling we were going from, but also the values. And so what I believe this policy is doing is it's taking those values and those principles, and it's taking science and medicine, and it's bringing it together to create a fair opportunity and a safe opportunity on the field of play. On your second question, we also felt that in the creation of the policy, we had to be very clear with ourselves as to what is in our control, what is in our remit. And we were very clear, and the working group was also very clear. Our stakeholders were very clear that that was the Olympic Games and Youth Olympic Games, and would go into the Olympic qualifying series, so Olympic events. And this, I think, was essential in the remit of the working group, and the work that we put forward is that it's within our space where we have control at the end of the day. Now, as we've said, and as the policy has said, that does not mean that we're not going to continue to advocate and promote sport being played at every level, because we see the values that sport brings. We see the unity that it brings into communities, the acceptance, the rebuilding. All of those are very important community-based soft skills that one learns at a young age, and that we will always continue to advocate for. But at the Olympic Games, as you know, the smallest little bit of an advantage can be what makes you a gold medalist or not. And for me, that comes back down to protecting the field of play and to having that field of play being safe and equal for all. And I feel that's what this policy does for the Olympic Games and for elite sport at the Olympic Games.
Thank you. Thank you very much. Let's go to Nancy Armour from USA Today. Nancy, if you can hear us,
Hi.
please. Yep, we can hear you.
Yep, I can hear you.
Please go ahead.
Great. This can be for either Kirsty or Jane, and two related questions. You mentioned repeatedly that this was based on science, but as far as I can see, the studies or the research that you based the decision on have not been included or published. Are you going to do that? And if not, why not? And then also, too, a study in 2024 raised questions about whether there actually was a competitive advantage, a study that was partially funded by the IOC. I'm wondering if that was considered, or if any of the researchers who were part of that study were included in the working group. Thank you.
Jane, I think, probably, yeah.
Certainly. Thank you very much for the question. Absolutely. I think from a perspective of your first question about a bibliography, so as extensive research has been done by many of the experts within the expert group, and from a perspective of the wide-ranging bibliography that is there, that does exist. Whether it will be published, it's not certainly published as part of the policy, but we do have that bibliography for which the experts have gone through and added to. So over the course, many of the times the experts themselves have been the authors on these papers. From just to your question about the 2024 paper that was partially funded by the IOC, I think there's going to be many questions around studies that have come out, and I think this is where we look at the quality of the study themselves, the actual population in question. I believe I recall the paper that you're referring to, and of course, we can't speak to any of the authors or, at this point, to the names of the working group. What I can say is that these papers have been extensively studied, but again, that one particular paper, as you know, in this particular area, there are a lot of limitations when understanding who the population is, if it's recreational, and how little it can apply to elite sport and Olympic sport. So it really does depend on the methodologies and certainly the application of those methodologies and the results. That 2024 paper doesn't have the athlete data that would be the Olympic data that we could give us an answer either way in terms of policy. But what I would say is that one of the aspects that the framework had very specifically, and that we will continue to have, is that these are subject to periodic review. So every time that there's a development in the science, that we will continue this work. And if there is a new paper or if there's something along those lines that does have high quality evidence that we can use and that can inform our policy, that those types of papers will be included. So just to ensure that the science doesn't stop here, that we'll be continuing to look at it going forward, and understanding that as we compile more data, we may have measures that will help us understand the situation, the topic more, and those would be integrated in future iterations. Thank you.
Thank you very much. Let's go to UK now. Rob Harris from Sky News. Rob?
Hi.
Yeah, go ahead.
Yep, hi. Thanks for doing this. Kirsty, can I just first of all ask, was there any concerns about having this sex testing applied for the Youth Olympics? So young teenagers are having to undergo this testing, and the science doesn't appear to have changed. Is it just the fact that legally it's now clear you can introduce such a transgender ban? And how much have you been influenced by Donald Trump calling for this ban on trans athletes?
Hi, Rob. Nice to see you, and thank you for the questions. I think on the second question, to start off with that, the policy, and many of you know me quite well and were following me along the campaign and know that this was a priority for me way before President Trump came into his second term. So there's not been any pressure from us to deliver anything from anybody outside of the Olympic movement. This was clearly driven by exactly what Jane has just said. Things have evolved, things have moved forward, and we need to ensure we're doing that. In terms of the first question, as I said before, and as the policy very clearly stipulates, that this policy will be for all Olympic events, including youth Olympic events. And this is where it was really important to us, and I hope you can go back through the policy and look at all the recommendations and guidelines in and around the safeguarding that we would like to see in place. We really went above and beyond, I think, talking to a lot of different athletes around how the process should be followed and what does that look like, and the support networks that need to be in place for the athletes. And so this really is, I don't think, is limited to a specific age group of athletes. We want it for all athletes during this implementation process. And I think what's really important also to give a little bit more context is this is the first phase, right? We're now stepping into the second phase where we're going to work with international federations, national Olympic committees to walk through what implementation looks like, to help develop these safeguarding opportunities, to help ensure that there's counseling being provided, to help ensure that the data and the athlete is being treated in the best way. So really, for us, that was very important, and I hope that you can see that come through in the policy.
Thanks so much.
Thank you, Rob. Okay, let's go to Associated Press, AP, Graham Dunbar. Graham, your question, please. Are you there, Graham? Can we?
I hope so.
Yeah.
I hope so.
We can hear. Yes, you are there. Indeed, I can confirm. Off you go.
Thank you very much, Mark, and thank you very much for doing this. A quick question for Kirsty. This presumably can and will be appealed to CAS. Can we be clear on who has standing to do that? Is that going to come down to individual athletes or a group of athletes? You know, we saw the way it became like a quest for Caster Semenya to finally get to the Court of Human Rights. So who do you anticipate will be able to appeal? And is it, if it comes to that sort of legal forum, would you be happy to go in there to, you know, present the case on behalf of the IOC as something, you know, you personally believe in?
Hi, Graham. Well, thanks for the question. I think you know, just like we do, whenever there are policies, rules, regulations in place, we will always have anyone that would be wanting to challenge it. What I can say, and what I hope that you can see from Jane walking through the steps, is that we really have, I think, done an extremely good job on taking everybody's views and bringing it all together to come up with a document that I hope will bring everyone together in I'm trying to think of the right wording, but that will allow for everyone to see that they've all been heard, right? And they can see themselves in that document. And as Jane said, the number of stakeholders that we've spoken to, including impacted athletes previously, they have had one-on-ones with Jane. And I hope that they can see the advice that they've given us is inputted into this policy. So, you know, Graham, we'll have to wait and see, but I don't think I can assume who would do what and when they would do it, but I think as we know in today's world, any and all rules and regulations at any point in time could always be challenged.
Thank you, Graham. Okay, next let's move on to Takafumi Yoshida from Kyoto.
Thank you very much for the opportunity. Could you hear me okay?
Yes, please go ahead. Yep.
I have a question to the President. I would like to know why this new policy is being considered and introduced at this timing. The LA Olympics will be coming up in 2 years, but was that a main reason, or do you have other reasons?
Thank you, Takafumi, for your question. For me, it's quite simple. This is something that I promised I would look at and review in my campaign, and I want to make sure that I'm a president that follows what I've said, and here we are today. And again, I'm really proud of the work that's been done, and under Jane and the leadership and the administration and the working group.
Okay, thank you very much. Australia now. Tracy Holmes. Tracy, your question, please.
Thank you, Mark. Thanks, Kirsty and Jane also. We know that there are some laws against genetic testing in some countries. Sport is a human right. The science is contested, as we've heard some people ask previously, including by people like Professor Eric Villen, who's a human geneticist, who says it's impossible to presume that a single gene determines performance advantage, etc. And that anyone who presumes that is using flawed science. So I just wonder what you say to people like Professor Villan, and also to people like Caster Semenya, who have fought for many, many years for the right of athletes like her to be able to compete in sport where the IOC says it is inclusive for everybody. And for Jane specifically, Jane, how will this work? Who pays for this, the stigma attached to it, especially when we are talking about teenagers, the Youth Olympic Games, or people hoping to get there, given that we know that some women who have these tests and then are shocked to find out that perhaps they're not XX, they may be XY with differences. And we know that there are athletes who have competed at elite level who have attempted suicide on finding out these particular discoveries. And so who pays for that, and who is responsible? Thank you.
Okay, I think we'll go to Jane first and then we'll come to the President. But Jane, do you want to?
Thank you. Thank you, Tracy. I appreciate all of the questions. And, I think just to speak on, first of all, the testing methods, and when you mentioned that your colleague was talking about a single gene determining sports performance. So again, if reviewing the policy, if you look at it from the scientific perspective, that it's not a single gene that determines sports performance, but in fact, the SRY gene screen is used. It's not a test of diagnostic of whether or not they have a certain sports performance or even condition, that it really is a screen for the development of testes and testosterone levels at the adult male level. And again, as we went through the process of the understanding from the working group that testosterone is not just during puberty, but that there are 3 peaks in utero, early in infancy, and also during adolescence. And so it's the testosterone that's the primary driver of improved sports performance, of that performance advantage in sports that rely on strength, power, and endurance. So one exception, as you mentioned in the policy itself, again, we're not saying a single gene determines it, but if someone has a SRY positive screen, then they would be evaluated for any of the exceptions. So again, SRY positive, but yet they may have exceptions. For example, if they have high circulating testosterone, but though their tissues cannot utilize that testosterone, they would not have that same performance advantage. To your other question, I think, too, and I think it's really important. I mean, from the perspective of, you can imagine if you're an athlete that there's an unexpected result, or if you're exposed at an event or an Olympic Games, and we've certainly heard reports of things happen over the years that we would not consider to be athlete-centered or athlete-friendly. And this is one of the defining aspects of the policy that we really felt that we wanted to include impacted athletes from around the world to be involved in the creation of the policy, but also understand that our approach, when we talk about screening, when we talk about education provided, when we talk about mental health and safeguarding resources, we wanted to involve impacted athletes, again, from around the world, from 5 continents, those that had DSDs, that have DSDs, that transgender athletes were included in this as well. And so that we would understand that going forward, that we would not have those same aspects, but really, what would it look like to do this well? If we had to do screening, what would it look like to do well and do this well? And I am so thankful to those athletes who shared their stories with us, who shared the way forward with us, because that is really essential for us. And the conversation is not over. We have a policy here, but really starts from here on in. From an implementation standpoint, we want to ensure that these organizations, the IFs, the international federations, the sport governing bodies, when this screening is performed, that these athletes do have access to mental health and safeguarding resources at every single step of the journey, that before they take the SRY screen, that they understand that through informed consent, what that looks like, what they understand throughout the process at every single step. They're the ones that decide to go for further evaluation. And so we understand that, and that has been part of the enriching process of being able to speak and learn from so many athletes across the world. So again, I completely understand, and from the perspective of the understanding that we need to involve athletes throughout this process because of the very things that you mentioned, and this is why it was very central to our process.
Thank you, Jane, and thank you, Tracy. Nice to see you, and thank you for the questions. I think just following up very quickly and to add to Jane, this is, as I said previously, this is the first phase, right? And the second phase is going to be, it has to be about collaboration. It has to be about creating educational opportunities, and it has to be about consistency. We are going to find ways. We don't have all the answers today on what exactly that's going to look like on the implementation. I do need to thank the international federations that have been involved with us throughout this process, some who are leading the way in this screening and are using and giving us their advice and their best practices that we're learning from, and we're going to be able to help the rest of the movement implement this in a safe way, in an ethical way, and in a human way, which I think, as Jane has eloquently said, was really a basis for the policy of this athlete-centered way forward. Just to add very briefly, I think, sport is inclusive, and it always will be. And we, as I said earlier, we will continue to advocate for sport to be played at every level, at every age, all around the world, because we know the benefits, we see the values, and especially in today's world. But we also need to give recognition that the Olympic Games have a focus on elite sport. And in elite sport, we need to ensure the fairness, the safety, and the integrity of all the competitions. And this, for me, is really important and is where that differentiation is.
Thank you
very much, Tracy. Okay, we're going to go to Tariq Panja from New York Times now, please. Tariq, over to you.
Yeah, hi. Can you hear me?
Yep, go ahead.
Hi. Just on picking up on what you said there, elite sport. There will be losers today as a result, or who will feel like they've lost something today as a result of this policy, Kirsty. What is your message to those people? Because that's happened. That's my first question. And my second question, I guess, is more of a process point of view. In certain countries, such screenings are, legally banned. For example, in France, you can't do this gender testing. We saw it with boxing. If you are in breach of national laws in some of these places, what is the kind of remedy here for athletes like that? And just finally, the world is resourced differently. Not everyone is sitting in Lausanne or Paris or London. There's all these countries that might not be set up for this. You talked about mental health help and all sorts of other aids and tools for people, but this won't be kind of a flat access, will there? You must be aware that in some countries these issues already are polemic and difficult. What are you going to be doing for countries that aren't as resourced as well as the places you and I are sitting right now? Thank you. So those 3 points.
Hi, Tariq. Thank you for those 3 points. I'm going to go from bottom up. I think on the resources and the difference, I think this is a very similar question that we potentially faced when we introduced anti-doping. And we will find solutions and we will work together. And I think one thing that we are making very clear with this policy is that it is collaborative in terms of the implementation. And we know that there are going to be needing financial assistance at different levels. And we're going to have to talk through how and what we do and where that leads us to. And so that, I think, can be done. I really do think it can be done. But it starts also with really, as Jane had said, and what we're putting foot first is education in and around what the policy is, how it can be delivered, and what that looks like for everyone. We've already had some of those conversations with all the international federations and the National Olympic Committees, and now it's that second phase on implementation. Your second question, and I think Tracy actually spoke a little bit to it, in and around the legality and some of the screenings being illegal in certain countries. Again, I want to thank some of the international federations that are already screening in athletes and for gender. And this is where we're learning from best practices. This is where we're able to see they're sharing best practices with us, that if it is illegal in a country, athletes will have the possibility when they travel to other competitions to be tested there. This is also why we're saying the policy comes into effect now, but will be implemented in LA28. So we have time to walk through this process with everyone, with all of the stakeholders. And on your first question, athletes really know and understand, I think, more so than most people, that with injuries, with rules, with regulations that change, with sports that go on and off programs, there's always sometimes they're impacted, right? And they're impacted negatively. But again, I do feel that this policy is a policy that is supporting equality and fairness and the protection of the safety on the field of play.
Thanks, Tarek. Let's go back to Australia now. Jacqueline Magnay from The Australian. Jacqueline.
I hope you can hear me.
Yep, go ahead.
Yeah, great. President Coventry and Dr. Thornton, congratulations on implementing this policy. I'm interested in the fact that you say that there is evidence of even perhaps more than 100% advantage given to biological males who over the female, if they're competing in the female category, especially in boxing and weightlifting. And that's two of the sports where there's been enormous controversy at the Olympic Games. I'm just wondering, you were not looking at any retrospectivity of this policy, but I'm wondering, what do you say, President Coventry, to these women who've competed in previous Olympic Games and they've had to be up against athletes who would now not be eligible to compete as a female? What do you say to them? Do you think that they're owed an apology?
Hi, Jacqueline. Nice to see you. And I'm glad you're looking better. Thank you for the question, and thank you firstly for saying congratulations, and I will pass that on to the team as well. You did say that we're not looking back retrospectively, and we're not. And as you know, in the former games that have happened, there were guidelines, there were principles, there were rules, there were regulations that were in place, and they were abide by all of the athletes at the time. We are now focusing forward, and as Jane said, this is a document that is going to continue evolving and hopefully getting better and better and better and strengthening. That is, I think, what allows for sport to also stay relevant. When we have fans around the world that are watching, they know that they're watching an event that has integrity, that is protecting the safety of the athletes on the field of play, and that is a fair access for all of those athletes competing. So this is what we've chosen to focus on. This is what we're going to focus on in the future, and I hope athletes, when they see this policy, that they know and they feel that those things are going to be as we move forward.
Thank you very much, Jacqueline. Okay, let's go now to The Guardian and to Sean Ingle, who has been interested in this topic for some time. Sean, over to you.
Thank you, Kirsty. I had two questions as well. Apologies. First of all, you mentioned the 1,100 athletes surveyed. Could you give us a sense of whether there was a broad consensus among women athletes behind the IOC policy? And secondly, I guess we go back to 2021, the framework was very different than the one we have today. Was there a eureka moment for you, or did your thinking change perhaps over time as you learned more about the science or what happened in Paris or whatever else?
Hi, Sean. Thank you for the two questions. I'll let Jane answer the survey one, and since it's a big part of the process. And for me, no, I think you and I have had conversations in and around this, and especially during the campaign. And I think coming from a sport where we've seen the impact, I wasn't competing anymore, I was retired, but it was, again, very much for me something where I felt there needed to just be fairness and equality, and so I don't think there was really any one specific moment, but coming back into the campaign, this is something that I'd promised to do, and so yeah, want to make sure that I'm fulfilling what I'm telling people, and I'm not just a mouthpiece.
Thanks very much, Sean, and nice to meet you, and thank you. I think for the question, because I think it's an important one. And again, we consulted athletes three ways, and one of which you mentioned that the athlete survey. And I really want to thank our colleagues in the athletes department for spearheading this, because it was a part of an athlete survey, part of the Fit for the Future process, and more than 1,100 athletes completed a specific survey question, which was, given the IOC's commitment to protecting the female category in sport, what do you believe are the most important considerations that should be taken into account from your perspective as an athlete? And this was a question we asked all of our constituents, and to get the athlete perspective was really encouraging and also very impactful and valuable for the process of the policy. Athletes from around the globe responded, so this included male and female, retired and current athletes, Olympians, and some non-Olympians responding. The responses were captured in numerous languages and translated to ensure that they were in the results. So one thing I do want to say was that we wanted to also ensure that when we looked at the results that we looked at specific groups as well. So we tried to understand, are there differences around the globe? Are there differences between retired athletes and active athletes? Are there differences between what males and female athletes would say? And I would say there were nuances in terms of what it would exist across sex and gender, region, and athlete status, but there was a strong consensus that fairness and safety in the female category requires clear science-based eligibility rules, and that protecting the category was a common priority. So they did tell us a little bit more about transparency, need for clarity, scientific grounding, privacy and dignity, and many of the aspects that you'll see in the policy and the athlete-centered approach as well. And so interestingly, when we talked about this before as well, but to understand that screening should be in fact part of a process of an evaluation that might already be done or as early as possible. These were aspects that were very clear from the beginning. And so essentially the scientific evidence was one of the prime aspects that came out of that survey that was important to the athletes in terms of considerations for the category. Thank you.
Thank you, Sean. Okay, we're heading up towards the hour, so I think this is probably going to be our last question from Xinhua. It's Ji Ye, if you're there.
Thank you. Thank you very much, Mark. Can you hear me?
Yes, we can. Please go ahead.
Okay, President Kirsty, today you announced the new policy, so it's a very good start of your reform. So I want to know how is the progress in other aspects in the Fit for Future reform, and do you have a timetable for this reform? Thank you.
Thank you, G. I appreciate that. So we do have a timetable, and I know today was really focused in on the policy, and we can send you a timetable of sort of where we are and where we're looking at trying to get for June. Since today we're keeping really the focus on the policy, but I thank you for your comments on that. And yeah, I'm just as proud as of the team and very grateful to the team and the work that's all been done behind this. And we'll share in an email with you on the progression on where we are for the others.
Thank you very much.
Thank you very much indeed. And that brings us to the end nearly of an hour. So thank you very much to President and Medical Director. Thank you very much for joining us. The policy is online, and I'm sure you'll have many more questions, but thank you very much for being with us today.
Thank you, everybody. We appreciate it. Thank you. Bye.